The silence of the WHO on the disappearance of scientific researchers and doctors, and on new restrictions on the sharing of research into the origins of COVID-19 in the country of origin is deeply concerning, especially when we put up by far the largest amount of money. Not even close. Had the WHO done its job to get medical experts into China to objectively assess the situation on the ground and to call out China's lack of transparency, the outbreak could have been contained at its source with very little death, and certainly very little death by comparison. This would have saved thousands of lives and avoided worldwide economic damage. Instead, the WHO willingly took China's assurances to face value, and they took it just at face value, and defended the actions of the Chinese government, even praising China for its so-called transparency. I don't think so. The WHO pushed China's misinformation about the virus, saying it was not communicable and there was no need for travel bans. They told us when we put on our travel ban, a very strong travel ban, there was no need to do it, don't do it. They actually fought us. The WHO's reliance on China's disclosures likely caused a 20-fold increase in cases worldwide, and it may be much more than that. The WHO has not addressed a single one of these concerns, nor provided a serious explanation that acknowledges its own mistakes, of which there were many. America and the world have chosen to rely on the WHO for accurate, timely, and independent information to make important public health recommendations and decisions. If we cannot trust that, this is what we will receive from the WHO. Our country will be forced to find other ways to work with other nations to achieve public health goals. We'll have no choice but to do that. Our countries are now experiencing, you look all over the world, tremendous death and economic devastation because those tasked with protecting us by being truthful and transparent failed to do so. It would have been so easy to be truthful. And so much death has been caused by their mistakes. We will continue to engage with the WHO to see if it can make meaningful reforms. For the time being, we will redirect global health and directly work with others. All of the aid that we send will be discussed at very, very powerful letters and with very powerful and influential groups and smart groups, medically, politically, and every other way. And we'll be discussing it with other countries and global health partners, what we do with all of that money that goes to WHO. And maybe WHO will reform, and maybe they won't. But we'll be able to see. As you know, in other countries hit hard by the virus, hospitals have been tragically forced to ration medical care and the use of ventilators. But due to our early and aggressive action, the skill of our healthcare workers, and the resilience of our healthcare system, no hospital in America has been forced to deny any patient access to a ventilator, with all of the talk you've heard, where some states wanted 40,000 ventilators. I said, that doesn't work, 40,000. And they ended up with 7,000 or 8,000. And they had no problem. 40,000 ventilators for one state. It was ridiculous. The scariest day of my life was about a month ago when, after a long day of meetings, my team told me that we were going to be needing 130,000 ventilators, that we were short hundreds of thousands of ventilators. This is the system we inherited. I had governors requesting unreasonable sums that the federal government just didn't have. And you look at the states didn't have, the states were not prepared. I knew that every person who needed a ventilator and didn't get one would die. And that's what we were told. They would die. I saw in other countries doctors having to make decisions on who got a ventilator and who didn't. And I knew that this would be a defining challenge of the crisis. Those that didn't get ventilators were said to be in a position only of one alternative, and that was death. Would we be able to prevent Americans from dying because we couldn't get them ventilators and the ventilators that they needed, and they needed immediately? I instructed my team to move heaven and earth to make sure that this didn't happen. We started to smartly ration and distribute the ventilators that we had and that others had. And I got daily updates on the supply we had from requests coming in and people wanting to have updates. We had a great group of people working on it. I instructed my team to use the Defense Production Act, and the Defense Production Act was used very powerfully, more powerfully than anybody would know. In fact, so powerfully that for the most part, we didn't have to officially take it out. It was a hammer. It was a very powerful hammer in order to manufacture as many ventilators as possible. Last year, America manufactured from a dead start 30,000 ventilators. And this year, the number will be over 150,000 ventilators. It could be as high as 200,000, far more than we'll ever need. So we'll be able to stockpile. We'll be able to talk to states about stockpiling. These are high-quality ventilators. We had a choice. We could do inexpensive, less productive ventilators or high-quality. We've done a high-quality ventilator. So we should have anywhere from 150 to 200,000 ventilators. In addition to that, we have 10,000 ventilators right now in the federal stockpile, ready to move. Should we need them? We might not. Should we need them in New York or New Jersey or in Louisiana or in Illinois or any other state that may need them if we have a surge? I'd like to ask Adam Bowler to come up and just say a few words. He's done a fantastic job, a young man who worked 24 hours a day on handling this situation, and I'd just like to have Adam, wherever he may be, come up and say a few words. Adam, please. Thank you very much.
Thank you. Thank you, Mr. President. At your direction, this country has worked hard over the past few weeks to ramp up ventilator production through all means possible. Thousands of ventilators are coming in now, monthly, with over 100,000 by the end of June. At the same time, there are over 60,000 ventilators in our hospitals right now that are not in use. Knowing this, and at your direction, we reached out to the American Hospital Association to design a system that allows hospitals to lend ventilators to other hospitals right when they need it. Within the past week alone, 20 top health systems have signed up for this dynamic ventilator reserve, representing over 4,000 ventilators. Not only do we have top academic systems like Cleveland Clinic and Mayo Clinic, but we also have top health systems from New York City, New Orleans, Washington State, and California. Over a week ago, these places would have needed help, but now they are here to help. There's been no American that has needed a ventilator that has not received one. This dynamic virtual reserve, combined with our strategic stockpile, will ensure that this is always the case. I'd like to thank the President for his leadership and directive to focus on public-private partnerships like this one. I'd also like to thank Sam Hazen from HCA, Lloyd Dean from Common Spirit, for leading this effort with the AHA and the Federation of American Hospitals. These have been difficult times. A few weeks ago, the Vice President came into my office, and he reminded us of the power of the resilience of the American people and of private companies. We needed it that day, Mr. Vice President. This partnership is another example of Americans helping Americans. Thank you.
Thank you very much. Fantastic.
Thank you, sir.
I'd shake his hand, but I'm not allowed to. Times have changed, haven't they? Thank you very much. You did a fantastic job. We're very proud of you. You and your whole team. Thank you. Today we are taking further action to maximize our oversupply and available ventilators. This afternoon I met with the leaders, the top people of many of America's big, powerful, beautiful, and very, very important hospitals and hospital associations who join us today. We had a great meeting, learned a lot, and they've been going through a lot. They've been doing a fantastic job, as everybody here will attest. I'm pleased to announce that my administration is partnering with the hospitals across the country to create an innovative new system called the Dynamic Ventilator Reserve, so that we're going to have tremendous numbers of ventilators that we're able to help our states with at a later date. If there's ever a problem like this, which we hope to God will never happen again. It was 1917, 1918. That's a long time ago. We hope it never happens again. And I'd like to ask Rick Pollack, CEO of American Hospital Association, Sam Hazen, CEO of HCA Healthcare, that's the largest in the United States, Warner Thomas, CEO of Ochsner Health, and if I could, My Hall. Are you here from Cleveland Clinic? Somebody? Good. Thank you. Come on up, folks. Please. Thank you. Say a few words.
Thank you very much, Mr. President. We appreciate the opportunity to work with you and your team on the Dynamic Ventilator Reserve